Heidi ho and welcome to Bataan 2016. This year we're providing your just-in-time training during the bus ride to Las Cruces. We hope that this will be informative for those that are returning and educational for those that are new and joining us this year. Thank you to all of you for providing your time and efforts in this endeavor. Let us begin by looking at dehydration treatment and the IV protocol. The purpose here is to set standards of care and treatment for patients who have become dehydrated. The policy states that licensed providers will plan, supervise, and evaluate the treatment protocol. Licensed providers and nurses will assess patients' condition and perform medical care as prescribed within the treatment protocols provided by the military. Looking at signs and symptoms of dehydration, we know that dehydration can occur when the body loses too much fluid. Mild dehydration symptoms include increased thirst, a dry mouth, and sticky saliva, with a change in color of urine to a dark yellow. Looking at moderate dehydration, we know that there's now extreme thirst, a dry appearance inside the mouth, eyes that don't tear, a decrease in urination or half the number of urinations in 24 hours. The urine is now turned to a dark amber or brown color. Lightheadedness that is relieved by lying down occurs. The patient becomes irritable or restlessness. Arms or legs that feel cool to the touch with a rapid heartbeat and muscle cramps can become evident. Severe dehydration now is showing altered behavior such as severe anxiety, confusion, or not being able to stay awake. Faintness that is not relieved by lying down, or lightheadedness that continues after standing for 2 minutes. The inability to stand or walk with an increase in breathing, and a weak, rapid pulse, followed by skin that's cold, clammy, or even can be hot and dry to the touch. Little or no urination for 12 hours or longer, and a loss of consciousness in extreme cases. In order to test your patient for dehydration, the key is 2 sets of vital signs that include a level of consciousness. Also want to look for fever, an increased heart rate, a decreased blood pressure, and faster breathing rates are all signs of potential dehydration and or other illness. By taking the pulse and the blood pressure while the person is lying down, and then after having them stand up for 1 minute, can help determine the degree of dehydration. Normally when you've been lying down and then stand up, we see a small drop in blood pressure for a few seconds. The heart rate then speeds up and the blood pressure returns back to normal. However, when there's not enough fluid in the blood, because of the dehydration, the heart rate speeds up and not enough blood is still getting to the brain, in which the brain senses this condition and makes the heart beat faster. If you're dehydrated, you'll feel dizzy and faint while standing up. Now, treatment for dehydration in patients involves replacing the fluids. Adjacent to every medical tent is a water station. At the water stations, there is water and Gatorade provided. Have the patient sip small amounts of water and or Gatorade if they're able to tolerate. If popsicles are available, they should be from juice or sports drinks and not sugary in nature. Having them suck on ice chips is an option, as well as sipping through a straw in order to slow down their intake to prevent vomiting. If there has been a heat exposure, or if the person has an elevated temperature, you need to cool the patient. Start by removing any excess clothing and loosening any other clothing that you can. Moving the patient indoors to an air-conditioned area is best for helping return the body temperature to normal and breaking the cycle. If air conditioning is not available, increase cooling by evaporation by placing them near fans or in the shade. Placing a wet towel around the person's neck will also help with evaporation. Using spray bottles or misters with lukewarm water sprayed onto exposed skin will help with the cooling process. Now avoid exposing the skin to excessive cold, such as ice packs or ice water. This will actually cause the blood vessels in the skin to constrict and will decrease rather than increase your heat loss. Exposure to excessive cold can also start shivering, which increases the body temperature, having the opposite effect. Fluid replacement. This is the key. If there is no nausea or vomiting, immediately start the fluid replacement by sipping the water or Gatorade provided from the water stations. If there are signs of significant dehydration, muscle cramps are an early sign, or one of the signs of severe dehydration, and you should consult a licensed medical provider on scene for IV therapy. By the time a person becomes severely dehydrated, there's no longer enough fluid in the body to get to the vital organs. Severe dehydration is a medical emergency and requires emergency treatment. Starting an IV and evacuating the patient to the nearest emergency room in Las Cruces or the start-finish line is warranted. This should be coordinated with the licensed medical provider at each medical tent and the tent liaison or tent lead. There are strategic tents that have ambulances and or medical buses pre-stationed in order to facilitate these evacuations. Now, if the patient's condition does improve, we may send them home, preferably in the care of friends or family so they can continue to monitor their condition. If the patient remains dehydrated, confused, or becomes feverish or has persistently abnormal vital signs or shows early signs of infection, the patient may need to be transferred to a hospital for additional treatment. Welcome back, and let's look at blisters and care of the foot. As pictured here, we have a blister on the heel of a foot. Blisters are often suffered as a result of friction and or pressure. Some of the leading causes of blisters are toe deformities, abnormal foot biomechanics, hind foot malalignment, a varus or valgus foot position, an increase in distance or intensity and speed during activity, new or poorly fitted shoes, and moisture. Blisters are less common in dry feet or feet that are very wet due to a lower friction threshold. Friction blisters are an acute response to relatively high intensity stress placed on the skin. Lower intensity chronic stress may result in the thickening of the skin in the form of a callus or corn. Blisters are often seen under a callus or corn. In order to prevent blisters, you must remove or lessen one of the three key ingredients. Those three key ingredients are heat, moisture, or friction. In order to prevent or eliminate those, having your shoes properly fitted and allowing for adequate break-in time is most appropriate. Second to that, wearing of synthetic socks high with wicking properties will decrease moisture. Changing your socks often while running or marching will also eliminate this high moisture content. We have seen and you will see antiperspirants, drying powders, lubricants, and skin tougheners used before and during the march. Orthotics have been shown to keep the foot in a neutral position, allowing for less frictional force placed in certain key points. Shoelaces, a often source due to over-tightening of blisters, can be reduced by using different lacing techniques that can be found online. Experienced runners will often wear gaiters, especially during the Bataan Memorial Death March, in order to prevent foreign debris from accumulating in the socks and shoes and thus creating friction. The wearing of insoles has been shown to reduce the incidence of blisters. Foot nutrition, the daily application of creams and lotions can keep your calluses soft. Maintaining your hydration, because if you have fluid deficiency, skin trigger can result in skin folding over on itself and rubbing more easily. If you maintain an adequate sodium status, hyponatremia, which is the swelling of the hands and feet, can cause waterlogged tissue that is soft and more vulnerable to physical abuse. By taping, you can form a barrier between the skins and sock to reduce friction. It can also be used early on for treatment of hot spots and blisters. When taping, duct tape should be used, preferably that which is very sticky or has a fabric core. Elasticon, sold over the counter by Johnson & Johnson, is a medium thickness elastic porous tape that can be used. 3M also sells Medipore, which is a thin, soft knit-like tape that conforms nicely to the foot. It also comes in Microform, which is a 1 and 32-inch thick soft foam tape. Band-Aids can also be used for simple blister relief. A word of caution when you use duct tape. Don't apply duct tape where it's not needed. Use a good quality tape where you can see the fabric core. Use a single thickness. Additional layers can cause elevations and thus change the layout of your shoe, resulting in friction points. When your tape is applied, the foot should be in its maximal extension point. Cut the ends of the tape so they're rounded and not square, and shave any area of hair when taping. Taping tips. Now tape before you run, or to fix hot spots and blisters before you even start. Start by cleaning the foot and drying thoroughly, and alcohol works well. Use tape adherent, tough skin and benzoin tincture. Use powder in other areas to counteract adhesives not covered with tape. Keep the tape smooth. If it's overlapped, the overlapping edge should be in the same direction as the force of motion. Cover any hot spots. Apply a thin layer of lubricant over the tape and around the edges. And when you remove duct tape, do so carefully and consider using baby oil. Practice taping so that you don't irritate your skin on the day of the race. Now, looking at taping specific areas, here are some pointers. When taping the ball of the foot, cut the forward edge so it does not contact or cut into the crease at the base of the toes or the toes themselves. If you're taping the toes, cover the tip with a longitudinal strip if this is the problem area. Circumferential layering should never extend so far that it digs into the skin between the toes. Taping against toenail friction. Tape the receiving toe rather than the offending nail. When taping the heel, a large patch of tape should be used to cover the entire heel. Apply with the ankle and the toes dorsiflexed, which means the foot pulling towards you. Use 1-inch circumferential strips to cover the edges. Now, if you're going to tape with elasticon, do not stretch the tape. Simply form it to the foot and press firmly. Areas where the tape folds or is pinched should be folded like a flap and cut flush with the skin. Blisters on the heels can suggest that the heel cup is too wide. Blisters on the dorsal or top of the surface or tips of the toes or on the outer borders of the first or fifth toes suggest problems with the friction in the toe box. You will also see downhill blisters form on toes and forefronts, and uphill blisters that tend to form on the heels and over the Achilles tendon. The goals of treatment for a blister is to avoid infection, minimize pain and discomfort, and stop the blister from becoming larger. For an intact blister, we apply a piece of moleskin or the adhesive felt that is 1.5 to 3¼ inches larger than the blister, with a center hole that's cut out larger than the blister. We then apply an antibiotic ointment over the blister, and then we place a piece of gauze over the moleskin, felt, or tape, and add a piece of adhesive knit or tape to hold that gauze in place. Now, if the rupture has blistered, a simple blister is the skin is intact. The treatment still consists of antibiotic ointment over the blister and the blister care of your choices listed above. Now, if the outer layer is torn off or only a flap is available, we do want to cut away the loose skin. We want to clean the area thoroughly and cover the new skin with antibiotic ointment. Then, as seen above, to cover with your choice. If an infection is present, we want to clean the site frequently, applying antibiotic ointment, soaking in warm water daily, and to stay off that foot and elevate it. If worsening infection, systemic treatment may be necessary as prescribed by your provider. Now, if you're going to continue running, we need to drain the blisters which are on weight-bearing areas that are over greater than 0.8 inches in diameter. With an alcohol wipe or hydrogen peroxide, we clean the site. Using a sterilized kneader, we lance 2 to 4 holes in the side of the blister. Use pressure to push out the fluid. We then want to again clean and dry the skin. Apply the benzoin around the blister. Apply a thin layer of antibiotic ointment over the puncture sites we created, and then the outer layer of dead skin should be removed. Apply a blister care product as described earlier, and check that site daily. If the fluid is hazy or cloudy, we're going to drain the blister, apply the antibiotic ointment and a protective covering, and check that site frequently. So again, if we find that fluid is hazy or cloudy, we drain that blister, apply antibiotic ointment and a protective covering, and check the site frequently. If having any questions during the treatment of blisters, consult with a licensed medical provider or the tent leader that is stationed at your area. Now, certain blister care products are available at each tent. Moleskin, which is a soft cotton padding that provides against friction. It also comes in a foam. We also will see Coban, which is self-adhering wrap. Its elasticity and flexibility allows movements of joints. Avoid applying too tightly, as it can become a constricting band. Any questions? You should see your tent lead or medical licensed provider and follow their directions and or orders. Thank you, and have a wonderful weekend, and thank you for your time and efforts.